Thank you for listening to Depictions Media Radio.
Hola, muy buenos días.
Hello, good morning, and thank you for joining us in this weekly press briefing of the Pan American Health Organization on the pandemic um, due to COVID-19 in the Americas. My name is Sebastián Oliel from the Communications Department of PAHO. The session will last 1 hour as usual. We have received your questions by email, and you will also be able to ask questions live and through the Q&A button. Please always include your name and your medium when you send your questions. Also, let me remind you that we have simultaneous interpretation into English, um, Portuguese, French, and Spanish, and you can select your language by clicking the interpretation icon. Today, Dr. Carissa Etienne, Director of PAHO, will talk about the situation of COVID-19 in the Americas. Dr. Etienne is accompanied by Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of the Department of Health Emergencies of PAHO, and Dr. Sylvain Andiguieri, Incident Manager for COVID-19, also from PAHO. Now I invite Dr. Etienne to give us her remarks.
Good morning, and thank you for joining today's press briefing. Over the last week, the region of the Americas reported over 1.1 million new cases and just over 24,000 COVID-related deaths. In North America, while cases are dropping overall, infections remain high in the American Midwest as well as in Alaska. In Canada, cases are also high in the Northwest Territories, where infection rates are 10 times the national average. In Central America, cases remain high in Belize, although most countries are seeing continued declines in infections. Infections are also dropping across South America, but we are seeing some spikes at the subnational level. For instance, cases are up in the greater Caracas area, Venezuela, and in parts of Chile's southernmost regions. In the Caribbean, Barbados is reporting the highest number of COVID cases and deaths since the pandemic started, following a five-fold increase in COVID infections over the last month. Cases have also increased in the Dominican Republic, Haiti, and smaller islands like the Cayman Islands, Antigua and Barbuda, and Anguilla. So we continue to urge countries to keep a close eye on how the virus is spreading locally so they can focus on controlling these outbreaks. Public health measures remain critical to control the spread of COVID everywhere, especially as vaccine supply remains limited. Last week, the WHO launched an ambitious new strategy to vaccinate 40% of the population of every country by the year's end. Our region has embraced vaccines, and 39% of people are fully vaccinated against COVID-19 across Latin America and the Caribbean. It is also encouraging to see that 26 countries and territories in the Americas have already immunized 40% or more of their populations. But that is not the reality everywhere. In far too many places, coverage is much lower. So today I want to spotlight those countries in our region that are lagging and that will require special attention to meet this 40% vaccination target. 6 countries in our region have yet to reach 20% of their populations. These are Jamaica, St. Lucia, St. Vincent and the Grenadines, and Haiti in the Caribbean, and Guatemala and Nicaragua in Central America. Across all these countries, vaccine availability due to unequal distribution of doses has been a central challenge. But many of these countries are facing their own unique barriers. In Jamaica, supply delays have gotten in the way. In Guatemala, shortages of syringes have delayed immunization campaigns. In Haiti, logistical challenges continue to delay the rollout of available doses. And across the Caribbean, vaccine hesitancy among some groups remains a problem. As we have said before, vaccines will help end this pandemic. And PAHO is committed to supporting every country in our region to reach and exceed these WHO targets. We are working hard to accelerate vaccine deliveries to our region, including the COVAX procured and donated doses, especially for countries where coverage remains low. We are supporting Jamaica, Guatemala, and Nicaragua in finalizing preparations to receive COVAX and the bilateral shipments in the coming weeks. In the last few days, we fast-tracked the delivery of a total of 1.3 million doses that were donated by Spain, Germany, the United States of America, and Canada. These vaccines are being used to boost coverage in Honduras, Guyana, Argentina, and Jamaica. We've also been glad to see countries within our region pitch in to support their neighbors by sharing doses so we can make the most of available supplies. As more vaccine doses are making their way to our region, we urge countries to make the necessary preparations so these doses can be used as quickly as possible. Based on the lessons from across our region, we know that the success of vaccination campaigns rests on having the infrastructure in place to roll out doses at scale. So now is the time to expand cold chains and invest in health systems, especially as financial institutions and donors alike have expressed their willingness to support countries to make these improvements. And now is also the time to hire and train health workers to ensure that vaccines can be administered quickly. Health workers are trusted sources of information for patients. So we encourage countries, especially those in the Caribbean, where vaccinations have been highly politicized, to train their health workforce at all levels so they have all the information that they need to answer the questions of patients and to help them understand the benefits of vaccine. Finally, to be effective, vaccine campaigns must also be designed around the unique needs of the population. Thanks to the generous support of Germany and the European Union, Belize has been able to promote COVID vaccines in public spaces where people gather, such as bus terminals and markets. We have seen how stipends, even small ones for food and transport, can help incentivize campaigns in rural and remote areas where travel to vaccination sites can be a challenge. In Bolivia, door-to-door campaigns by community leaders have helped boost coverage among rural communities, and small cash transfers have also helped incentivize more pregnant women to get vaccinated. In Brazil, we've seen the impact of weekend-long vaccine drives and vaccine champions to encourage everyone eligible to get vaccinated. These and other tailored strategies will be key to reaching those that we have not yet reached, not just in the countries where coverage remains low, but in every corner of our region. Low vaccination coverage leaves us all at risk. So we must work together and support each other so that every country in the Americas can reach or surpass the 40% vaccination coverage target by the end of the year. The actions we take over the next 3 months will help us save lives, make the most of available supplies, and determine our outlook for 2020.
Muchas gracias, doctora Etienne.
Thank
Vamos
you
a...
very much, Dr. Etienne. Now we're going to go on to questions and answers that we have received from you via email, and we're also receiving questions from the Q&A. Remember, when you send your questions, please identify yourselves by giving your name and your medium. First question by several journalists is related to third doses of vaccines. We have from Emilia Wexler, from Clarín Argentina, Mariana Vela, from Canal 7, Peru, Mariela Soquet from the Q&A, also from Venezuela. Question is similar. What is PAHO's, WHO's position regarding the use of third doses, taking into account, and in which cases are they recommended, and if the third doses should be given to the whole population, and are the third doses recommended only for Sinovac and Sinopharm, and also what age limit to start getting that third dose? Dr. Barbosa, thank you very much for your questions. Whenever we answer questions regarding vaccine recommendations, I always say, and we all say, that we follow the recommendations from the SAGE team, which is the strategic group of experts uh, on vaccines from WHO. They have reviewed all the evidence and studies, and they have given recommendations on Monday regarding third doses for vaccines. The recommendations that I can talk about. First, there is a recommendation so that all vaccines that have received the emergency use license, because again, the SAGE group from WHO only reviews those vaccines, eh, those people with immune suppression, either moderate to severe, people, for example, who have active cancer, or people who have received an organ transplant, and those who receive organ transplant need to take medications to decrease the activity of the immune system. These are also people with certain immunodeficiencies. There are several conditions causing this situation. People with HIV, AIDS, people who are taking medications that can decrease the ability of the immune system, for example, corticosteroids. And so SAGE is recommending a third dose of any vaccine that has been approved by WHO for emergency use. That third dose preferentially should be given with the same vaccine that you receive as a first and second dose. But if you don't have access to that given vaccine, you could use another vaccine among the ones that have been authorized for emergency use by WHO. There is no safety problems when you use another vaccine as a third dose. There's another recommendation which is specific for Sinovac and Sinopharma vaccines, reviewing the data, and many data produced in Latin America regarding the use of these two vaccines. It has been found that protection provided by these vaccines for older adults is lower than for other adults. So the recommendation specifically for these two vaccines, Sinovac and Sinopharm, is that in addition of being used for people with immunosuppression, that older adults should start to receive a third dose. And you should begin with people older than 80 years of age. and those uh, over 60 who have comorbidities. But let me underline that there is a great diversity, a large diversity of coverage and access to vaccines in the region. So, also, SAGE has made a strong recommendation that priority should be to reach full protection with 2 doses in all priority groups first. So, countries that have not reached protection of the most vulnerable groups, that should be the priority for those countries. So, these are the recommendations from the SAGE uh, group of experts, and which we here at PAHO are following in our conversations with the countries to implement these new directives. Thank you. Thank you, Doctor. Next question is from Melina Ochoa, reporter from Uno TV in Mexico City. According to the Federal Health Secretariat, Mexico has had 10 weeks um, in the decrease in numbers of COVID. Could, could we have a yet another um, outbreak in December? And could non-vaccinated people lead to the emergence of new variants of co, SARS-CoV-2? We have two very different questions. The first question regarding mortality, the number of deaths is going down. It's going down regularly in the last 3 to 4 weeks. Regarding the preparations for winter, winter has always been good ground for seasonal diseases to spread, such as influenza. So there's a risk of reactivation of cases during this period, which, in addition, corresponds with the year-end holidays, which lead to higher transmission rates because there are more travels, etc. The Sentinel network, which includes about 500 surveillance sites, is active to detect early cases, including influenza and COVID-19, and the National Center of Influenza, based in Indre, is sharing its information regularly with PAHO. Regarding genomic surveillance aspects, which is related to the second question, it is important to mention that Mexico has sequenced about 30,000 full genomes of the SARS-CoV-2 virus, and all these sequences have been reported on the global databases at present, and I mean at 30. Epidemiological Week 38, where we have the most recent data entered in the database. The Delta variant is predominant in Mexico by a large percentage. It is important to remember that the more the virus is replicated or allowed to replicate, the more the possibilities to generate variants. And for this reason, it is necessary to maintain all protection measures and control measures, including vaccination, not only to decrease transmission from person to person, but also to reduce the risk of hospitalization or death. I hope I have answered the questions from Ms. Melina Ochoa. Thank you, Doctor. Next question is from Vanessa Davis from Contrapunto.com in Venezuela. The question is there any change in strategy against COVID-19 in Venezuela due to the appearance of cases of yellow fever in humans? Question is, should we prioritize fighting yellow fever above prioritizing COVID-19, and what consequences can there be for the population with the co-circulation of coronavirus and yellow fever virus? Dr. Ugarte, Thank you very much. I will answer part of it and then I'll ask Dr. Aldiguieri to report specifically about some details of yellow fever in Venezuela. Regarding the strategy of response to COVID-19, yes, in recent weeks, we have seen an increase in cases in Venezuela, more in some states where health services have been overburdened with patients, and also in other areas where there is an increase in transmission with with differences between states and localities. Venezuela has reported the most cases, comparatively speaking, as opposed to other countries in the region. And so response to COVID-19 should be reinforced, especially whenever there are increases in transmission or wherever there are increases in transmission, and also when there is an increase in the demand of for health services for causes related to COVID-19 and other diseases, such as the outbreak of yellow fever. So, in those cases, it's necessary to strengthen the healthcare networks and also strengthen the public health measures to prevent transmission. And those areas where there is an increase in demand in the health services, for example, in those areas where uh, some outbreaks of yellow fever have been reported, even if they are small. The response that has been done in Maturin, for example, in Monagas state, is work coordinated with national and local authorities, and we are implementing joint measures to control the outbreak. The response in general is done according to a risk analysis of each event, and in this sense, yellow fever as well as COVID-19 need to be approached specifically given their own specificities and dimensions without decreasing response to COVID-19. Yeah, and now over to Sylvain, who will give some information about yellow fever. Yes, thank you, Dr. Ugarte. First of all, let me say that Venezuela is one of the 13 countries that are endemic for yellow fever in the Americas. So it's a known disease in Venezuela. In this particular case, human cases reported by the health ministry of Venezuela are seen in the context of an epizootic wave. So there have been cases in monkeys that have been confirmed in territories in the state of Monagas and Anzoátegui in the northeast of the country. And we're talking about jungle transmission. Let me emphasize the tight cooperation between PAHO, our teams, and the national authorities in the strengthening of surveillance of yellow fever in humans and also in non-human primates. In regarding confirmation by the National Reference Laboratory, the Rangel Institute, and the deployment of vaccines in the of vaccines. Uh, this situation has been reported by the channels or through the channels of the IHR. The information has been published by PAHO in an epidemiological update on its internet webpage a few days ago, and we will do another update whenever it is necessary. I hope I have supplemented the answer that was given by Dr. Ugarte very comprehensively. So, thank you very much to both of you. The next question is from Ana Herrero from the Washington Post. And from the chat, she says that yesterday the Cuban government assured that they have exchanged information regarding their vaccines with PAHO, and also they assured that they have shown results of their clinical studies. And the question is whether PAHO has received the necessary information from uh, Cuban vaccines, and are Cuban vaccines under review by WHO? Thank you very much for your question. Yes, it is true that PAHO is facilitating a dialogue between vaccine manufacturers in Cuba with the pre-qualification department for vaccines in WHO. For us, it is very important that all vaccines against COVID-19 can participate in the bidding processes for the revolving fund and that they can offer their vaccines through the COVAX mechanism. And in order for us to consider vaccines, PAHO can only consider those that have been granted the emergency use license by WHO. We had already had a very productive meeting. Cuban manufacturers have provided the data, and and we are sharing with them whatever is necessary to initiate the process of review and assessment of the vaccines. So it is not really PAHO the one doing the review. PAHO facilitates and supports the exchange, but the manufacturers of Cuban vaccines, as well as vaccines from any other country, need to submit the documentation and all the information and all the standards that are demanded from all manufacturers, no matter what country, so that the pre-qualification team at WHO can review and in the end grant the emergency use license. So we are supporting and will continue to support the dialogue between Cuban producers and WHO so that the authorization process can continue. Thank you very much. Thank you. Thank you. The next questions are from Andrea Hamilton from Magnetic Media in Turks and Caicos. In English, she
COVID-19 and others set to come on stream. Y también pregunta, can we provide a characterization of the states of the Caribbean some 18 months into the pandemic? How is the Caribbean seen as coping in the fight against COVID-19? Dr. Aldighieri?
Yes, thank you for this series of questions. These questions are covering very different aspects. Regarding the new antiviral medication developed by Merck, with the limited information that was shared with the scientific community 10 days ago, it looks very promising. However, please note that so far, the Pan American Health Organization has not received more detailed information about the recent studies. Therefore, we are looking forward for a first evaluation by a stringent regulation authority as the FDA in the United States, and the publication of the data by the Merck researchers for starting our assessment process and a potential discussion, inclusion in our recommendations for clinical management of COVID-19. Now, regarding the dynamics of the pandemic in the Caribbean, please take into account, one, the extreme diversity of the different patterns of transmission among Caribbean countries and territories. And two, that the Caribbean mainland countries in the Guyana Shield have been closely linked to the dynamics in the Amazon basin. I'm talking about Guyana, Suriname, and French Guiana. So already two different groups of countries. What we can say is that most of the Caribbean island countries during 2020 have been relatively protected from community transmission due to the implementation of strict public health measures and travel restrictions. Unfortunately, this scenario was not repeated during 2021. At the moment, with very few exceptions, all Caribbean countries are reporting community transmission, and as an example, in the Eastern Caribbean, health services have been or are still overwhelmed by the influx of patients requiring hospitalization. Another important challenge that the Caribbean is facing, English-speaking countries and French-speaking countries and territories is the vaccine hesitancy. Even if some territories of the Caribbean are leading the regional efforts in terms of vaccination coverage, we can say that the vaccine uptake is suboptimal in most of the Caribbean countries. So people who are eligible for vaccination and are offered vaccination should embrace this opportunity as a way to protect themselves from serious consequences and to protect others in their families and communities. I hope that I have answered the concerns of the journalist in the Church and Caicos. Thank you.
Gracias, doctor. Siguiente pregunta es de Nancy.
Thank you, doctor. The next question is by Nancy Salguero from El Salvador, and she's asking about Haiti. How's the situation given the political humanitarian problems in the country, and also how's the vaccination situation against COVID-19 in Haiti? Dr. Ugarte. Thank you, Sebastian. Thank you, Nancy. The situation, the social political situation in Haiti continues to be quite tense, and it has impacted greatly on the efforts by the government, PAHO, and all of the partners in terms of vaccination boosters and also the responses provided by the teams in the areas that were affected by the 7.2 earthquake. The delivery of essential medical equipment and medicines in the earthquake stricken areas has been blocked by the constant blockage of the Port-au-Prince roads, as well as the scarcity of fuel, which is quite significant. However, the field teams of PAHO and the teams continue to be quite active and fully functional, and they are working closely with the leadership of the local authorities to be able to provide assistance and all of and support to the health centers. I would like to mention that we were able to mobilize health support, for example, emergency medical equipment from health partners that are in the most affected areas and that were able to provide emergency health care and also the restoration of the critical services and also support for medicine. As to vaccination, the vaccination against COVID-19 has also been impacted by the safety and security situation, in particular in the area of the capital, Port-au-Prince. Over the recent weeks, PAHO has been helping the Ministry of Health to expand the number of vaccination points to be able to accelerate the administration of the vaccine, and so far it has been slow. Those efforts, together with the mass communication campaign that has been recently introduced, led to a daily increase in vaccination. And
so far, about 95,000 shots of Moderna vaccines have been given nationwide. 69,000 first doses and 26,000 second doses. The Ministry of Health in expanding its reach with the opening of the new COVID-19 vaccination sites throughout the country, and there are now more than 120 functional sites on the Haitian territory. So this is an important advance, but we expect that the vaccination will increase. And to counter also those restrictions and also the vaccination hesitancy, a national communication strategy has been recently finalized by the Ministry of Health and will be implemented with the assistance of PAHO, UNICEF, and other partners. Gracias. Thank you.
Gracias, doctor.
thank you, doctor. Next question is by Raisar Santos from Health Policy Watch.
Brazil has hit 600,000 COVID-19 deaths. Why is Brazil experiencing such a high death rate? Y también tenemos otra pregunta
And we
relacionada
also have a question that is related.
high in many countries in the region, and what can they do to reduce them? Doctora Etienne?
So let me thank you for this question. Unfortunately, the first COVID peak in Brazil was extensive, and it affected not only large cities, but even remote rural areas. And as those cases increased, health services were strained to care for patients. With the start of the second peak in Brazil, the spread, and that was spurred on by the spread of the Gamma variant, health services became even more overwhelmed. And there weren't enough health staff or enough hospital beds to deal with the cases. This was also the situation in other countries with high numbers of cases and deaths as well. Until vaccines started becoming available, our best response was to apply the proven public health measures: physical distancing, widespread mask wearing, avoiding closed and crowded spaces where possible. And these are still important. But we have learned some valuable lessons on how to focus our response in areas that have high transmission, the so-called hotspots. National health authorities can provide a localized rapid response, like deploying national emergency medical teams to support health services in areas experiencing flares in cases. And those are national EMTs. With better surveillance and data on exactly what is happening in specific areas, countries can focus on the early detection of the hotspots where cases are spreading rapidly, and a quick response combining rigorous implementation of public health and social measures with a surge in human resources, equipment for health services that are at risk of being overwhelmed as well. Several countries have also reported an increase in cases in the younger population. And we believe that this is related to the greater exposure and the absence of vaccination in these groups. This increase in cases leads to surges in hospitalization, both in intensive care units and other areas. By planning to deal with sudden increases in the consumption of critical supplies like oxygen, intubation drugs, personal protective equipment, and equipment such as infusion pumps, health services can focus on these hotspots where cases and deaths might increase if action is not taken. So we must reiterate that vaccination is important, but vaccination campaigns against COVID-19 are not by themselves enough to prevent the transmission of SARS-CoV-2, especially in populations that are not eligible to be vaccinated. We continue to urge countries to maintain the measures of public health and social distancing in accordance with their epidemiological situation.
Muchas gracias, doctora
Thank you
Etienne.
very much, Dr. Etienne. The next question is by Alessandra Ferreira from CNN Radio in Brazil, and her question is,
Can you do for Latin America and the Caribbean for 2022? Dr. Barbosa?
Thank you for the question. CNN Brazil is a Brazilian radio station, so I will answer this question in Portuguese so they can use the original audio. Muito obrigado pela pergunta.
Thank you very much for the question. It is difficult to have a projection for 2022 because, as our director mentioned in the beginning of this press conference, we still have 6 countries in the Americas which have not reached 20% yet. In other words, they have not been able to protect even the most vulnerable groups who are at risk of dying and developing the more severe form of COVID-19. Only 19 countries in the Americas have vaccinated over 50% of its population right now. And only 3 countries, Chile, Uruguay, and Canada, have already vaccinated over 70%. We are going through a situation, as we have always reinforced in the press conferences, that equalitarian access to vaccines is one of the most severe problems we must solve so that countries can control the transmission as soon as possible. PAHO has worked either to accelerate the deliveries using the COVAX mechanism or to facilitate donations, which have been essential so that in August and September, the countries in the Americas had more access to vaccines, and also by means of direct purchases using the OPA's rotatory fund, which may be used as well. Of course, we want it to happen as fast as possible, but we still need to have a lot more vaccines. The most important message for us, if we want to control the epidemics in 2021, first of all, we have to use the public health measures. Number two, we should expand vaccination as fast as possible by means of a more equalitarian distribution of vaccines throughout the world. Thank you for the question.
Thank you very much, Doctor. The next questions on Nicaragua, we have several we have received via email and also through the Q&A button. Kelly Romero from Confidential and also Lydia Lopez from La Prensa and other journalists are asking us the following. They're saying that on Monday they were expecting to receive a donation of Pfizer vaccines through COVAX to Nicaragua, but that donation did not arrive. The question is whether there was any challenge and whether there has been rescheduling of that delivery and what would be the date. What is needed for Nicaragua to identify the circulation of variants in the country, whether the authorities have already reported progress in connection with this to PAHO. Dr. Ugarte. Thank you, Sebastian, Kaylin, and the other colleagues. There has been a delay in the delivery of COVAX, and we are making efforts for the vaccines to arrive by October 18th. Since this delivery would delay the start of vaccination on pregnant women, PAHO is making efforts in trying to identify countries that may offer vaccine doses to Nicaragua, other countries that may have them. And we thank for the first delivery from a neighboring country to Nicaragua. We continue to try to find other solutions, other collective solutions for cooperation among the countries to be able to provide vaccines and reach the common goals in Nicaragua and also in other countries that have low vaccine coverage against COVID-19. We hope to have positive results. As to the variants, I would like to reiterate what we have said before. We would like to report that Nicaragua has received all of the support necessary by PAHO to identify COVID-19 variants. We have also been informed by the Ministry of Health that the report on variants is being prepared and we expect to receive it as soon as possible. Thank you. Thank you very much, Doctor. We have several questions in Spanish and English in connection with the Delta variant. Manuel Lino from Eje Central in Mexico, he's saying that there have been reports by the UK, Denmark, and Canada indicating that the Delta variant is not only more contagious, but also leads to more severe disease. And he would like to know PAHO's opinion. And Kevin Feldmine from The Guardian in Trinidad and Tobago is asking in English.
In Tobago, there has been significant detection of the Delta variant, and this corresponds with an increase in the number of children being hospitalized with COVID-19. Are children less resistant to the Delta variant? If so, why? Doctor Aldiguieri podría contestar estas
Dr.
dos preguntas.
Aldiguieri, would you please address these questions?
We would start with the question from Trinidad and Tobago. And I would say that Dr. Etienne has already answered part of the question during the last series of questions. Several countries have reported an increase in cases in the younger population related to the greater exposure and the absence of vaccination in these groups. We know that older age groups are usually more careful with the control measures, stricter about the distancing, and also that the adults have been prioritized for vaccination in most of the countries, including the Caribbean countries. Also, it's important to mention that if a particular variant becomes predominant, like the Delta variant at the moment in most of the Caribbean, it is, of course, the one variant that we are going to find affecting most of the population, including either asymptomatic, mild, or severe cases. Ahora, la pregunta
Now, as to the question from Mexico regarding reports coming from Denmark, Canada, and the UK, we are aware of several studies that are trying to document the virulence of the various variants that have been published or that are underway. In spite of some findings, there is some data that also indicate an increase in hospitalization and also death cases due to some areas of concern. However, there are striking differences among the epidemic waves that are difficult to adjust, and there is a great deal of information that is relevant but not easy to obtain. Therefore, the cause-effect relationship cannot be inferred only through those studies. It is clear that the scientific evidence on the severity of some variants such as Delta is increasing, but even if the evidence indicates higher risk for hospitalization and death for Alpha, Beta, and Delta, the results may be biased due to confusion and also observation bias, and they cannot be conclusive. It is also important to mention that several models based on animals consistently indicate that there is no increase in virulence of any of the variants identified so far, alpha, beta, and gamma. With all of that information, or having said that, I think that it is the most important point to underscore is that prevention by implementation of strict health measures and health control measures, including vaccination, should be maintained to avoid transmission, regardless of the potential virulence of any variant. I hope I addressed both sets of questions. Thank you. Thank you, Doctor. The next questions are related to Venezuela, in particular vaccination in Venezuela, by Sami Paola Martinez, journalist of Transparencia Venezuela, and also through the chat, Mariana Soquet from Efecto Concuyo is asking something similar. They would like to know whether COVAX would be sending Sinopharm and Sinovac vaccines to Venezuela for third doses. When are the 8 million remaining vaccines going to be allocated through COVAX? Whether you have information, what vaccines will be sent, when, and whether PAHO knows if Sinovac has been administered already after being sent in September by PAHO. Dr. Ugarte, thank you very much for those questions, Sebastian. WHO, through their expert group on immunization, publishes information on vaccine efficacy or vaccines that are being studied, and they updated the recommendations. And so far, the main recommendation is to attain high coverage based on the vaccine available. And we hope that those doses are still sent to those countries that have low coverage. And following this, and also following PAHO's and WHO's recommendations in connection with additional vaccination of vulnerable populations, for example, individuals who are older than 70 and who are immunocompromised, we continue to look for options based on the vaccine availability, which continues to be quite low. As to when the 8 million vaccines are going to be allocated, I would like to say that we are looking for solutions of delivery that attain the best dates for delivery to Venezuela. Venezuela has been included in one of the priority countries for the arrival of vaccines. So once the flights are attained and also the delivery is organized, we will be delivering as soon as possible. As to Sinovac, the country is delivering the vaccines available, and they have also started to go door to door for vaccination. We cannot confirm that the Sinovac vaccine has been initiated, but it is important for the country to have the doses available and also for the vaccination system as well as the cold chain and the vaccination process are being implemented so that the national goals are attained. And we hope that we can have this information at the soonest so that the population is informed about the delivery of this vaccine. Thank you. Thank you, doctor. Next, we have several questions. Two questions related to vaccination of children and adults. Melina Ochoa from TV is saying that a judge ordered the secretariat to vaccinate to children younger than 18. The judge decided that children and adolescents should be considered a population vulnerable to COVID because they have not been vaccinated, and by returning to school, their exposure is higher. She's asking what is PAHO's opinion, and Jason Collabe from El Comercio in Peru is saying that Peru already has a protocol to start vaccinating youth between 12 and 19 years of age by November with the Pfizer vaccine. And the question is, what is WHO's recommendation? To vaccinate younger children or to close some gaps to reach unvaccinated adults? Dr. Barbosa, thank you for those questions. They're very important. I am certain that the countries have their own justice systems and laws, and the countries have their own conditions to use the evidence that they already have. It is very important for the decisions made by the countries to be based on the evidence that we have. I think that the strategies for vaccination need to follow the knowledge we have, need to follow the strategy that is being applied. The strategy recommended by PAHO and WHO from the outset is to vaccinate first the most vulnerable populations, because that's the first task of the vaccine. That is to say, the first goal of vaccination to save lives. So to start with the elderly, with the adults that have chronic diseases, vaccinate also health professionals, and then continue to vaccinate other adults. As to vaccination of teenagers, that is not a priority, because for teenagers and children, as we always say, the data we have from all of the countries show that they are not the most vulnerable groups for severe cases and deaths due to COVID-19. We already have vaccines that have been approved by WHO to be administered to teenagers between 12 and 16 or 18 years of age, and those are Pfizer and Moderna vaccines. The countries that have already completed all of the vaccination of the priority groups may start vaccinating teenagers first, teenagers that have some sort of disease that may have a higher risk for severe cases, and then all of the teenagers. This is a decision to be made by the countries, and it is also important to maintain priorities. That is to say, only after vaccinating all of the elderly and all of the adults, then we can start with teenagers. That is important because in a situation in which we have limited access to vaccines, if we do not continue to implement the strategies of the national plans, we can start vaccinating groups that are not so that whose priority is not so high, and we can stop vaccinating, for example, the elderly or individuals that have chronic diseases who may have a higher risk of dying due to COVID-19. So it is important to maintain all of the strategies implemented by the Ministries of Health and based also on recommendations issued by PAHO and WHO. Thank you. Thank you, Doctor, and we are reaching the end of this session today. Another question sent by Jason Collaber from Comercio in Peru is saying that with the current indicators and the progress made with vaccination, does PAHO have any expectation as to when the epidemic could be under control in the region? Dr. Etienne.
Thank you, Koravi, for what is a very important question. From the beginning, let us be clear that the course of the COVID-19 pandemic in the Americas remains highly uncertain. PAHO has developed three possible scenarios for the near future, 9 months. And we are sharing this with the UN's Economic Commission for Latin America and the Caribbean, ECLAC, or CEPAL in Spanish, in a joint report on the prolonged health crisis and its impact on health, the economy, and social development. The scenarios depend largely on two related factors: the implementation of public health and social measures and the dynamics of vaccination coverage. So let's talk about scenario A. In scenario A, where vaccination coverage is low and the public health and social measures are not sufficiently implemented, we expect high rates of community transmission to continue, leading to continued high rates of hospitalization and deaths. In scenario B, where countries maintain adequate implementation of public health and social measures, but have low vaccination coverage, these face periodic increases in cases, hospitalizations, and deaths. An alternative scenario B is that countries have high vaccination coverage, but low implementation of public and social measures. These countries face periodic spikes in cases. The best outcome is scenario C, where we have adequate public health and social measures that are maintained over time, and that is accompanied by high vaccination coverage, generating a situation in which hospitalization and deaths are reduced over time. But to achieve this outcome, we need equitable, timely, and affordable access to COVID-19 vaccines and related supplies, which include like cold chain and syringes. We also need effective implementation of national immunization programs. This requires financing at all levels of the operation, especially for the staff to run these immunization programs. Socioeconomic and political factors, of course, also play a role in these scenarios. Countries with higher levels of poverty and social exclusion may not be able to implement social distancing measures or hand washing practices, as well as their counterparts in richer countries. Behavioral and cultural factors such as vaccine acceptance or hesitancy misinformation about vaccines, social conflict, and even natural disasters will also play a role in determining the course of the pandemic in the coming months and years. Without timely concerted action, there remains the possibility that COVID-19 may become endemic. And that's why PAHO is advocating and we are putting in place measures for quick, equitable access to vaccines for all who are eligible. And that's why we are repeatedly appealing to persons to get vaccinated as soon as it's possible. And that's why we are appealing to you to adhere to proven public health measures. This is everybody's business. Let's each do our part to protect ourselves, our communities, and to restore the economic development of our countries and our region. Thank you again for joining us today.
Muchas gracias, doctora Etienne. Ahora sí, entonces.
Thank you very much, Dr. Etienne. Now we have reached the end of today's session, and before we conclude, we have a small announcement. Tomorrow at 10 a.m. Washington, D.C. time, we will be having another press conference together with the Economic Commission for Latin America and the Caribbean, where we will be presenting the joint publication on the prolongation, the extension of the COVID-19 crisis and its impact on the health, the economy, and social development of the region. So we invite you to participate tomorrow on Thursday at 10 a.m. Washington time, and we will be sending you the chat message for you to register and participate in that session, which will be led by Dr. Etienne and the Executive Secretary of ECLAC, Alicia Bárcena. Thank you all for connecting today to this session, and we will continue to be in contact. Greetings to all. Thank you.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.